A public health crisis. The U.S. Surgeon General made the declaration on gun violence this week. Dr. Vivek Murthy warns the epidemic not only impacts victims of gun violence, but also the mental health of our country as a whole. It's driven by the growing number of injuries and deaths involving guns in the country. Washington correspondent Jesse Turnure shows us the recommendations made by the country's top doctor.
This type of advisory can help shift the course of public health history, most notably when it raised awareness about the dangers of smoking tobacco. And Dr. Murthy tells me that's what he's hoping for here.
Gun violence is a public health issue.
That's the new advisory the nation's top doctor issued Tuesday that aims to reduce gun violence across the U.S.
Gun violence has now become the leading cause of death among kids and teens. And that was not true a decade ago or 2 decades ago.
Surgeon General Dr. Vivek Murthy says the advisory not only focuses on the deaths and injuries involving firearms, but also the ripple effects.
Those reverberating traumas have taken a toll on the mental health of our country.
Murthy says public health advisories can make a difference, pointing to the 1964 Surgeon General report about the dangers of smoking tobacco.
That ultimately dramatically dropped smoking rates from 42% in 1964 to under 12% today.
Murthy's advisory on gun violence proposes a ban on automatic rifles, universal background checks, and penalties for people who do not safely store their firearms. The National Rifle Association quickly condemned the advisory, saying, "This is an extension of the Biden administration's war on law-abiding gun owners. America has a crime problem caused by criminals."
We need Congress to keep pushing for and passing new legislation.
But Rob Wilcox with the White House's new Office of Gun Violence Prevention says the advisory should push lawmakers to put partisan politics aside,
so that we can keep saving lives in this country.
And Murthy tells me in the absence of action at the federal level, state lawmakers, even community organizations and schools could adopt some of his recommendations. In Washington, I'm Jesse Turnure.
The U.S. Surgeon General's announcement came with policy recommendations that will never pass a divided Congress, like banning the sale of weapons like the AR-15. But he also shared other ideas about prevention, including early intervention. Will Dupree looked at how those programs are already at work in Texas.
Gun violence recently hit close to home, devastating the loved ones of those killed in Round Rock.
Now my family is left with a void.
It hurts, it does, but I'm getting through.
This tragedy underscores the work to prevent deadly shootings.
We're seeing the rise in violent crimes involving guns, and it is our job to respond to those trends.
Shayna Fox leads the Council on At-Risk Youth, a nonprofit that held more than 1,800 students in Central Texas this year with skills to avoid violence and crime.
We are a school-based mental health program where we do individual and group counseling, and we are at 20 schools around Central Texas.
Early intervention like this is part of the recommendations from the U.S. Surgeon General.
Firearm violence is a public health crisis.
Along with community violence prevention programs like ATX Peace.
Our mission, number one, is to end gun violence, period. Now, the way that we do that is that we have violence interrupters.
They're putting themselves in between two people sometimes that want to harm each other with guns.
Since starting almost 2 years ago, ATX Peace says it helps stop at least 15 retaliatory shootings from happening. It, along with other groups, credit money from the city and county for helping grow their work, and they're counting on the Surgeon General's latest announcement to boost that support in the next budget process.
We need more funding to continue to support the efforts that we have already in place.
Will Dupree, State of Texas.
If it's happening at a reputable hospital, what do you think's going on at your community hospital?
Your life in the hands of someone who is in training. The lawsuit filed against heart surgeons in Texas, accused of leaving medical residents alone during procedures.